Good evening, fellow interns, LI staff, and judges. Today, our group is here to present our presentation on our awareness workshop for typhoid fever.
Okay, so today we're going to be covering topics including health literacy, treatment and prevention, and we're going to be presenting our workshops that we have for each of them.
General information.
So I want to start off by giving a general definition of what is typhoid fever. We will go into depth about this later, but the general definition is that typhoid fever is a bacterial infection that goes spread throughout the body through contaminated food or water sources.
These are just some statistics about typhoid fever. Roughly 128,000 to 161,000 people die from typhoid fever per year. Luckily, the infection rates are going down because increasing awareness decreases infection rates. 35% of typhoid fever cases come from Africa.
The Nigerian government funds 5% to healthcare systems.
Part of the reason that it's so difficult for people in Nigeria to treat typhoid fever is because of corruption in the Nigerian government. The CPI, the Corruption Perception Index, defines corruption as an abuse of entrusted power for private gain. On the CPI, Nigeria ranks 154 out of 180. Nigeria has a weak regulatory system in the government, so it's easy for people to misuse funds that are supposed to be going towards healthcare.
Okay, so as Dr. Aisha mentioned at the beginning of the week, Nigeria is a tropical area, so it's situated in between the Tropic of Cancer and the equator. This means that it's more prone to tropical diseases like typhoid from occurring, and that coupled with the lack of infrastructure makes it a great breeding ground for the disease. So, so this chart is kind of complicated, but I'm just going to do the basics. So basically, Nigeria is in what we call stage 2 of this demographic transition model. It means that it has a very high birth rate and a lowering death rate. This means that the overall population growth is very high. So when the population growth is high, people are moving more into industrial jobs. So this means that people are going into urban areas more. And when there's a lot of people and a lack of infrastructure available to them, and they're all moving together, it creates, once again, a great breeding ground for typhoid fever. So this is some of the lack of infrastructure that I found. So lack of proper piping and waste disposal. When somebody goes to the bathroom, that can get into public water supply easily. And once people drink from that public water source, it can get into their bodies and cause typhoid fever. Also, the lack of proper health care or affordable health care can make it way more likely for somebody to die from typhoid as they're not being treated early. Also, the limited access to soap and water make it hard for people to wash their hands, making food more contaminated, which once again, when it goes into their body, the Salmonella typhi can infect them with typhoid fever.
Before we get into the activities, we also want to point out the fact that there are more problems than just the death rates and how many people have it. First of all, as we all learned, males catch typhoid significantly more than females. And that causes problems in the family lives in Nigeria because in Nigeria, males tend to have the dominant role, which, without the males, sometimes the family lives can be flipped upside down. On top of that, children between the age of 5 and 19 are affected more than most people. So this can lower the future generation numbers. And last but not least, hospital bills can stack up, especially when someone's in the typhoid state, which is pretty much just like a coma-like state. And if they keep on gaining hospital bills, in the future they'll lead to having a poor life and a lot of debt.
Okay, so the first part of our presentation is health literacy. So before we start, we're going to introduce ourselves to the team. My name is Drew.
I'm Cody.
I'm Evan.
I'm Tarun.
I'm Vernika.
I'm Samika.
And I'm Jessica.
And so basically, health literacy means finding creative ways to spread awareness to our target audience.
Okay, so I'm going to provide a general overview of the healthcare or health literacy section. So essentially it's a template for a workshop based in Nigeria, which will educate young adults about typhoid. Doing so will ensure that both this generation and the next generation will it will raise awareness for both this and the next generation. So these are our objectives. So one objective we strive to achieve is for participants to understand typhoid as well as what a bacteria or a pathogen is. Another objective we aim to achieve is for the participants to identify which symptoms correspond with typhoid and which symptoms don't. In addition to this, participants will understand and be able to identify ways that typhoid is spread and ways that they can get typhoid. Lastly, participants will be able to understand how typhoid travels through the body.
Okay, so just some information to mention before we get started with our workshops. Number one, Nigerian culture is very unique, but sometimes it can cause some problem for health in the country. So the first thing I put on there is some conditions are not meant for hospitals. So by conditions, this could mean symptoms, which means early treatment is not possible, which means that once again, the death rates will rise from typhoid fever. Also, to preserve the culture, some may reject vaccinations. Vaccinations are seen as a part of Western medicine, and the culture groups, the tribes, try to make themselves as unique as possible. So this may mean rejecting vaccines because they're of Western ideal. Also, it's important to mention before we start that we are taking into consideration that there are a greater amount of illiterate people in Nigeria than there are in the United States.
Okay, so I just want to talk about a little bit of the symptoms of typhoid fever. So down below are a bunch of beautiful cards Evan made. So a couple of symptoms include abdominal pain, fever that is always steadily increasing. You could have diarrhea, vomiting, constipation, and all the other ones on the left.
So, Salmonella typhi is the bacteria that causes typhoid fever. The bacteria enters through the mouth. The incubation period is 7 to 14 days. When the bacteria enters the body, it goes to the bloodstream. And Salmonella typhi lives in dark, wet places. So typhoid fever affects the gastrointestinal tract, which includes the abdomen, gallbladder, liver, and spleen, and it can also affect the muscles, lungs, and kidneys.
So this is our first activity. It's called Typhoid Symptoms versus Non-Symptoms, and it's pretty self-explanatory for the most part. We have made a deck of cards, as you saw earlier, made by Evan, and pretty much we give them a bunch of cards, and they break up into groups, and they just try to decide which ones are symptoms versus non-symptoms. And at the end of the event, of the time period, the LI staff member will come out and tell them what's the correct answer so they can learn the different symptoms.
Our next activity is called Understanding the Causes of Typhoid. And in this activity, there are two parts. The first part involves a Q&A or a guided discussion with the participants and the facilitators. And then after that, in the second part, we want to make sure that our participants are actually understanding the causes of typhoid. So they will be doing a group activity, which is a game, in which they'll be split into smaller groups, and each group will be given a flip chart. So the facilitators will be reading off scenarios with real-life situations, which may or may not include causes of typhoid. And based on those scenarios, participants must decide whether or not the person in the scenario can have typhoid. So they will then write yes or no on their flip chart, and at the end, the team with the most points and who's gotten the most number of questions correct will be the winner.
And our final activity is called Human Anatomy. So we came up with this because we wanted to demonstrate how typhoid exactly affects each of the body parts. So how this activity works is there's going to be a giant life-size human body printed out. So all the facilitators will be asking questions about if you were to drink contaminated water, what part of the body will be affected. We will have participants volunteer, and they will get picked, come up, and what they're going to do is, if it enters from the throat, we're going to go and take a marker and draw arrows through the entire body to see how exactly typhoid affects each part of the body. So it may start at the throat, then it might go to abdominal pain. So you draw just to make the process way more clear and how any contamination or carriers can affect the body.
This is our fourth and last activity, and it's a true or false game. So pretty much what it is, also quite self-explanatory, is we split the room in half using a blue line of tape or whatever color they decide. And one side's going to be true, one side's going to be false, and we're going to quiz them pretty much. We're going to ask a true or false question just on the overall disease of typhoid, and they're going to go to the side that they believe is correct. And once again, once all the questions are read, whoever has the most correct will be the winner.
Okay, so now we're going to go into prevention, and I'm going to introduce our team. My name is Tally Winkowitz.
I'm Sarah.
I'm Rowan. I'm Rhonda.
I'm Dashley.
I'm Tanya.
I'm Rima.
So to start out, I want to talk about simple steps to prevent the disease. Now, commonly the best way in the medical world is through a vaccine, but as we know in Nigeria, this is not always accessible, whether this be due to cultural beliefs or even just the access to healthcare that is unfair in Nigeria. So a common way to help prevent typhoid is to wash your hands constantly. And also, you want to use clean water for everything, but we know that not everyone has access to clean water. So later on in our activities, we are going to be talking about how at home you can help clean your water to make it safe. With that clean water, you're also going to want to thoroughly wash and cook your food to kill the bacteria. And you're also just going to want to maintain good personal hygiene in general to help decrease your chance of catching this bacteria. And again, I just want to reiterate, we want to avoid contaminated food.
Now, while these preventative steps might seem very obvious or intuitive to us, there are so many social determinants of health that get in the way of achieving prevention or having accessible treatment. First of all, the gender dynamics in Nigeria are very different from what they are in the Western world. What you see in Nigeria is that women are more likely to take roles in the domestic sphere, meaning that they're more involved in the cooking and cleaning, which puts them at more risk to be exposed to the bacterial agents of typhoid fever, because they are working in areas closer to food or closer to sewage. However, as we referred to earlier, men are more likely to actually develop typhoid fever because of the disparity in who is actually eating. Because men are more often the heads of households, they tend to eat more of the meals and get more nutrition, which means that they may actually have a higher chance of ingesting Salmonella typhi. Additionally, lacking water sanitation infrastructure is an important difference that you see in different regions of Nigeria. If you look at the more urban south with cities like Abuja and Lagos versus the northern region where Bauchi is, you see a great regional disparity in the level of infrastructure and development that there is. This also spills over to health access and the cost of healthcare. The quality of healthcare that a citizen would get in Bauchi State is greatly different from what they would get in, for example, Lagos. This also relates to inconsistent access to education. We've talked about health literacy and how key this is in our knowledge of how to prevent and treat typhoid. But when you don't have basic education or access to higher education, it's harder to create a health system with qualified and a high enough quality of physicians to treat typhoid. Additionally, living in poor communities, as we've heard throughout the week in our discussions on public health, leads to chronic stress. And that has physiological implications in terms of reduced immunity, which is necessary in fighting typhoid.
You can prevent typhoid by washing your hands, boiling your water, and vaccinations.
To begin our workshop, we're going to start with a trivia section for just to begin it off. To start it, we're going to quiz the audience on their typhoid knowledge, whether it be just general sanitation like we've been talking about earlier with hand washing methods or just cleaning in general. It's an introduction into what we'll cover throughout the entire workshop. And it's also important to begin the workshop in a fun and enjoyable manner, which allows the participants to open up a little bit and be more receptive to what we're giving to them for material. For the second part of our workshop, we are going, as Ashley and Tally mentioned earlier, we're going to be giving them information on how to properly sanitize water. And this sanitation method is extremely important because, as we know, water is used to clean all sorts of substances and all sorts of platforms, which is crucial in preventing typhoid. After we finish the instruction on properly cleaning water, we're going to talk through and discuss the major themes of water, sanitation, and hygiene, which will allow for the participants to learn further skills that they can apply throughout their life rather than just applying the water sanitation right at the moment. And then after this section is finished, we're going to provide antibacterial soap, bleach, and disinfectant kits so the participants can help out and clean their houses right immediately in the moment after they've learned all these useful information.
Thoroughly cleaning your food will help a lot, but with cleaning, and not only does typhoid fever spread through not being clean, but through urine and sewage. Sanitation will reduce the spread of this disease and many others.
So when we wanted to realize how we could make the biggest impact, we realized that, well, none of us grew up in Nigeria, so we don't realize the traditions and the cultural aspects of it. So to make the biggest impact, we decided that a prominent religious figure could have a sermon at one of the areas, because that would make a much bigger impact, because those are people who lived in that area, so they know the situation and the culture there. So the people in Bauchi would be much more appreciative of that. So.
The next section is treatment. In this section, we will describe options that vary from at-home remedies to medically encouraged treatments. Before I start, it's my pleasure to introduce you guys the treatment team. Who's right here. My name is Deborah Hughes.
I'm Peter Boyle. My name's Josh Uhas.
I'm Paris Winters.
And I'm Emily Skew.
So the next focus will be on how to properly treat typhoid fever.
So the objective of our workshop here is to stop the spread of misinformation on typhoid treatment. So there's two main typhoid treatment. The first is through antibiotics, and the second is through the traditional method. The traditional method has many different cures. We'll be mostly focusing on two of them. And so we have one activity, which is just learning all the information, and two more interactive activities for the audience.
Okay, so there's two types of treatments. There's a traditional approach and a medical approach. The traditional approach focuses on more herbal remedies, and they're cheaper and they're easier for them to access because they're there for them year-round. Where the medical approach is harder for them to get and it's more expensive, but it's the more successful way, and there's like less options for it, and it's not as easy for them to get there.
So this slide is about treatment availability. So first I'll start with the traditional method, and the two ones we focus on and we factually proved were guava leaves and lemon juice. For guava leaves, when you boil guava leaves and consume them, it's actually a herbal remedy which works to lower fever and to help with stomach pains. The next is lemon juice, and lemon juice is very commonly available in the Bauchi state because lemon is grown through all 4 seasons, and so lemon juice is vitamin C and it also helps to reduce your fever. Now on to antibiotics. I'll mostly focus on ciprofloxacin because it's mostly prescribed by the doctors, and Cipro is the best cure for typhoid fever. The only problem is it's expensive. So if it's too expensive for the consumer, we would recommend our two traditional methods.
So antibiotics are used because it kills the bacteria and stops it from spreading and reproducing in the body. And there's many different types that can be taken because, for example, if a patient has allergies, immunity, or is pregnant, they have many different options that they can use to treat typhoid. And then guava leaves too also reduce the amount of mucus that is made in the respiratory tract. And for lemon juice, it has a lot of vitamin C, which is good for the immune system and helps boost it.
Alright, so now onto our workshop. Our first activity, we really wanted to make it more about the information. We wanted to make it accessible. So what we're going to have is the facilitator, we're going to give them a script so that they can let the participants know about everything, that they can walk them through. It's going to be papers. It's going to be flyers and little trifold brochures filled with lots of images and enough visuals so that even if the participants aren't completely literate, they can still follow and understand. We also wanted to make it really accessible and able to use long term. So with these flyers, they can take them home, they can show other people so that they can really spread out the knowledge throughout the community. The other thing about these is that they Okay, cool. Yeah, so they help give a visual of the effects, like this one. It's how much water they really need to be having. So that lets them know, okay, I need to have water, I need to rehydrate, and we have that here.
Activity 2 is a matching game. Beforehand, the facilitator would give out and explain the flyer and the trifold. With this information, the participants can then do the matching game, which is just a simple, easy, and fun way to review the information that they just learned.
So the third and final activity is a little quiz, and the quiz, this is the questions here, is kind of the final activity in the full workshop. So it's not only is it a refresher for ours, but we have a little bonus for the refresher, which refreshes for the whole workshop. This little quiz is kind of like a final, and the main reason we have the quiz is actually for people to ask questions. So in our instructions, we allot a lot of the time of this workshop for people to ask questions about what they're confused about and any concerns they have for the future.
Okay, workshop details.
So our target population will be parents because they are likely to come in contact with the Salmonella typhi through things such as cooking or working. And ages 5 through 19 are most likely to contract the virus, so we would like to also include that. And we also like to include the teachers because they will educate future generations on typhoid fever.
Okay, so the program implementers are the Nigerian staff. We felt that this would be more beneficial because these are people of their ethnicity, so they won't feel more as if Western ideas are being pushed onto them. Also, we assume that most people would not want to be taught about a disease by a ton of teenage kids. Ultimately, we are trying to make them feel more understood so that they don't feel as if that they aren't being heard or we're trying to teach them something that they aren't used to.
Okay, so this is just a quick timeline that we put together. It's very self-explanatory, you know. We want the staff to familiarize themselves with the plan, buy the materials, advertise and stuff. After the workshop has been run, we also want them to go over our pre and post assessments, which will be shown shortly, to review what the participants learned and didn't learn, what they liked and didn't like.
Okay, so now we're going to go over our funding. So we were given a budget of $1,500. So we're going to give a breakdown as to how much each group spent and how much we have remaining and what we're going to do with it. So we're going to start off with health literacy. Refreshments will be provided for all 3 groups, which is costing us $50. And then we have flip charts for one of our activities, which is costing us $90. And then we have markers. All 3 groups are doing some type of writing activity, so markers will be useful for all 3 of us, which is costing us $8. And then we have papers. So we're buying a stack of papers because a lot of us have like matching cards and things we need to print on paper, so all of us can use it. And we were told that the Nigerian staff has printers there, so we formatted everything in a printable PDF. So it's easy, they just need to put the number of attendees in and they will print as many copies as needed. And along with that, we are, like I mentioned, our human activity. We need to print like a life-size human body, and that's costing us $17. So health literacy has used $171.
For prevention, as you can see, we will be giving disinfectant bleach, which will total to $100, and then the DIY disinfectant kits, which will be $155, and then antibacterial hand soap, $12, and then flyers will be given to the audience, which will be 30 posters, which is $18, and then 50 take-home personal size flyers, which is $14. So the total for the prevention team will be $299.
Alright, so now for the treatment. We're going to have enough flyers, like I said. We already had the room and paper, so these were already provided, as well as writing utensils. And we're going to provide or allocate money towards purchasing antibiotics for those who may need it of the participants. And also in our script, to make sure, we're going to let them know about the dangers of antibiotic-resistant bacteria.
Okay, so totaling everything up, we still have $530 left. So what, as a group, we've decided is we're going to take those $530 and put it towards primary care appointments. Each appointment is around $30, so it'll cover at least 15 people. But we do want to make it clear that, let's say in any of our activities we do run short of anything money, this is kind of like our emergency fund. So we will be pulling money from this $530, but for now it is going towards primary care appointments.
Reflections.
So, affordability. We really tried our hardest as a team to make sure that our budget remained below $1,500. And we were very passionate about making sure that we had allocated money as an emergency fund. And we really wanted to make sure we had money for patients to go to the clinic if they felt sick, as we know not everyone has access. So, as community expenses are limited in Nigeria, only personnel and space are required for our workshops. And participants will receive items that make hygiene at home more affordable, and so they are informed as to what they can use.
I will be talking about key takeaways that we wanted you guys to stick with. So I'll be starting with clean water, which, as everyone knows, is one of the basic things that we as humanity need. Nigeria has a struggle with getting clean water, and so we do believe that our presentation will help in our workshop to get them to have clean water. It is used in cooking, washing vegetables, cleaning, basically everything. So, as we were making this, we wanted to really think about the fact that this is a different culture, and we have talked to both Umar and Dr. Aisha about how to make it not offensive and try to understand the ways that their culture works, and either them applying it to us, we are going to make our things go to them. And then we are wanting to use WASH, which is an acronym for Water, Sanitation, and Hygiene, as our base for what we are doing. It is a global work that is working on getting people to have more clean water accessible. For this, we are wanting to think more about long-term instead of just short-term. It is good to give them food and stuff, but that's only going to last so long. So we are wanting to have the most impact that we can have in their lives. And using this, we are wanting to have, as it was talked about previously, the homemade remedies, or knowing that antibiotics can be so difficult to get to and they have other effects, have them access to that. And we are making this to have more preventative efforts instead of having to have a lot of money going into a medical burden.
So with this project, we have many future goals that we want to be able to achieve. First of all, we want to be able to spread greater awareness about Nigeria's typhoid fever and water quality issues. Because water quality issues affect so much more than typhoid fever alone, it's important that we address awareness about that root issue first. And then we would also like to continue providing training on how people can use the water sources that are available to them as we work on repairing infrastructure and allowing for greater accessibility. Additionally, gaining greater community feedback on this project will help us develop more in the future so that we can really make sure that this initiative is a two-way interaction that allows us to get information from the community on what was or was not helpful. Finally, we would want to make sure that our project does the best that it can to serve the community in order for other international investments through time, seeing as volunteers could recognize this as a viable way to invest in other communities, or other organizations could invest funds in projects like these in order to get underserved communities more access to the water sanitation and healthcare that they need to fight typhoid. Finally, there are some things that other people can do to help. It's important to educate one another about the issues that occur in developing countries, because they often aren't just issues for developing countries, they become issues for all of us. It's also important to encourage vaccination and sort of address the stigma around vaccination, as is already a pattern that happens in Nigeria as more and more religious leaders start to educate about vaccination. And finally, researching organizations and smart ways to donate funds in order to create long-term infrastructure that will last for several generations.
So as Evan mentioned earlier, we have a pre and post assessment. And so basically this is there to make sure that our workshops are actually effective and that they're actually doing work. So at the beginning, the Nigerian staff can use this to figure out what information they have to emphasize and what information they might not have to talk about as much. And then at the end, we can use this to figure out how much our participants actually learned.
These are some of our references. Along with all of these sources, we would like to thank Dr. Aisha and Umar for helping us inform our entire project.
And also thank you to our team leaders as well. Just remember when you leave here today that awareness is key. That is how we're going to make sure that our future is bright for not only Nigerians, but the rest of the world. Thank you.
I can see you guys are already excited about your presentation because you know that you have really done a good job. And I'm telling you this, I listen to every slide and I enjoy every slide you present. You have rich information, you have make your background research very well. I really love that. But for some reason, I don't know why you guys don't use like so many images for your presentation. It is the only thing missing. But your presentation is perfect. In fact, it's more than perfect because you give a very rich information that you communicate to us and we fully understand what you guys are talking about. But what I'm worried about is just that the people that we're going to communicate to, sometimes the images speaks louder to them. Does that make sense? But you guys have everything to make these people understand something about typhoid. I'm serious. Like, I don't know. I don't have like much things to say about your presentation because everything makes sense. Everything makes sense. So that's the only thing that is missing that I think before you leave this place, you should try as much as possible to add those images so that your presentation can stand out among all. But you guys are incredibly did well, and I'm really proud of all of you, and the confidence is something else. I really love that. So nice job and congratulations. And please don't forget those images. Are really, really important. I know you talk about many tools, flyers, you know, the anatomy of the person. So I'm expecting to see all those things appear in your presentation, but for some reason, you guys didn't put them there. But you explained those things very well to the extent that everybody understands where you're going, what you mean, and it's very clear. All right? So congratulations, and job well done, guys. You really make it happen. Thank you.
Thank you. Thank you, the Typhoid group, and thank you, Umar, for your feedback as well. Well done for this highly elaborate presentation. The slides, the font, I don't have a single problem. Okay? They're very clear, straight to the point, and beautiful, beautiful graphics for the health literacy team. Your graphics were very, very nice. Okay, so your activities were very easy and straightforward. So that's a really, really good job. Okay, the activity 1, 2, 3, and 4, all easy and straight to the point. Okay, so I like easy stuff because it makes the activity really possible. And since you're going to have the pre and post test, you're definitely going to see a positive effect with that. I just have one small concern with health literacy. When does when does a patient get to go to the hospital? It wasn't mentioned. Okay. Yes. When ever you're creating awareness, you have to say when so develops, you have to go to the hospital. It wasn't highlighted, but it was good. And I was expecting it in your objectives because you want to prevent. You remember I told you guys from as simple as fever and abdominal pain, the symptoms can get as complicated as having to have operation done. Okay, so you will want to highlight that this is the point where one needs to get to the hospital. Okay. The prevention team, social determinants, perfectly put, perfectly said, perfectly explained, with confidence, with finesse, with everything. I love that. It was really amazing. I have just one question for the prevention team. Who are your target audiences?
Oh, that would be parents ages 5 through 19 and teachers.
Okay, cool. Thank you for that. Wonderful job. It was great and simple and understandable. For the treatment team, I'm glad that you cleared the misunderstanding, the misinformation, okay? It was really wonderful. And for the traditional medications you are suggesting, how true do you think these herbal remedies work? How much, I don't know, scientific? I don't expect an answer. Okay, I just I just wanted to highlight. But if you have an answer, please, I'm willing
you
to.
only chose like 2 out of 50 that we looked at. And
Okay.
These two were like the most proven, and it has to do with like the content of like the lemon juice, which is vitamin C, and like the guava leaves had some microfibers.
Okay.
Really good for like the stomach and fever. So like, we only choose like the 2 that we like knew for a fact were like proven.
Okay, because you know I'm really, really careful when it comes to treatment. Okay, meaning that once you tell a patient, here is a medication, take and go home, the person is not gonna seek for further help. He's gonna go home and relax. So you have to be 100% sure that you're actually helping this patient, not wasting the patient's time. Okay? What I mean by wasting time is the person is getting sicker because of your decision. So that's why I always and almost always put my life on the line that medicine is going to work if you take it appropriately. So that's why I'm asking I'm not asking for your source, but how true do you think? So are you confident enough that, look, when a patient comes to you with suspected case of typhoid, that you say, okay, go take guava or lemon, you're going to be fine? Yeah.
We're also, so we were told, like, when I asked us as a last, we really wanted to stress that it was as a last resort.
Okay.
So, if you really can't do anything else.
Instead of doing nothing.
Instead of doing nothing, this might help with the pain, this might help with the diarrhea, so you don't lose more water.
Okay.
And some sources that it said it helped with the fever.
This makes a lot of sense to me now. Thank you. Now I'm more informed. Thank you very much. You guys had really good slides. Okay, the fonts were easily readable. Your activity was also easy, and yes, I was really interested in this team because you had me. You just awakened my sense of attention. So you had really good content that actually aroused my attention. Okay, so So well done, guys. It was a really, really wonderful job. I don't want to say we saved the best for the last, so the rest won't feel left out, but it was really, really wonderful. Okay? Thank you and congratulations, guys.
I really have one thing that I have to say about the entire presentation, because it was present throughout the whole thing, is that you had the information that was expected, the information you needed to include, and then you went one layer deep and included even more information, connected even more things. I loved how the social determinants, we talked about them, but then we also talked about how having the illness affected the individual, the family, and society on the flip side. And so everything just went one step deeper, which was really, really awesome that you were able to do that throughout the entire presentation and fit all of that content and all of that information in. So that is really my one thing that it brought your entire presentation up to the next level. So really great work with that. And congratulations.